Hello friends, I am Dr. Sadeep. In my channel, I will be uploading videos concerning practical aspects of homeopathy and how to practice homeopathy in a classical way. So I have already done many videos on this topic, friends. If you are interested to master the steps of homeopathic practice, please come to my channel and see those videos. And in the description, I have given the link of my channel. So today's subject is, I have already done one video on this posology, the basic law of posology. So today we are going to understand what is this physiological, pathological and therapeutic doses. So these are the three types of doses we usually see in practice in medicines. So here, what do you mean by physiological doses? What do you mean by pathological doses? What do you mean by therapeutic doses? So, and in homeopathy, we use which type of doses? So, firstly coming to physiological doses. So, as the name suggests, it is a misleading term used in medical faculty, medical subject, that physiological dose itself means that it is a curative dose. But unfortunately, the meaning of physiological dose is a manipulative term. That is to say, if you use this physiological dose, this is in larger doses, that is to say in milligrams and above milligrams. So this produces the proper accurate poisoning effect in the body system and in the cell system. Due to that reason, they call it as physiological doses. Whatever the allopathic people are using is physiological dose. So many of the medicines, what they are using is in the physiological dose form. Due to that reason, the common word they are using this as physiological dose, because in English, that is in allopathy, what they will do is they will have a bypass dose. That is to say, whenever they give the medicine in the physiological dose, they will see to it that if it is bypassing the liver, because whatever the medicines, whatever the poisons, whatever the substance which can produce the alteration in the body system will be first going to liver, because liver is a filter wherein it will filter all the poisons, all the medicines, all the which produces the harmful effect for the body. So this allopathic people will give the medicine which can bypass the liver. Due to that reason, they will usually choose this physiological dose so high that it will bypass the liver. So in that condition, they will call it as first pass. That is to say, whenever the dose is given in the highest possible quantity, then the liver will be confused and liver will not take care and it will leave a partial dose of medicine into the bloodstream. Due to that reason, they will test on the animals, they will test on the many of the experimental animals, and then they will come to a conclusion, this medicine in this much of mg, it will affect properly. So that is called as first pass. So in homeopathy, we never use this physiological doses, friends. So in physiological doses, what is that is the cells, the tissues and the organs are damaged. So we will never use any of the homeopathic medicines in physiological doses. Next, coming to the pathological doses. So this pathological dose, as the name indicates, that it is pathological. So wherein the toxicological of the substance is observed. So whenever a pathological dose is given, there is a possibility that the person will not sustain the effect of this pathological dose. It is very high to produce the death of a person. Even the physiological dose has a capacity to produce the death of a person. So this physiological and pathological are unscientific and it is not at all related to homeopathy, friends. So what we use is a minimal dose. What we use is a therapeutic dose. So this is the third medicine. This is the third term we usually come across in the posology, that therapeutic doses. So this therapeutic dose is nothing but a medicine form or the quantity of medicine wherein it is very minimal. So this minimal amount of the medicine which triggers the organism, which triggers the cellular system, which triggers the body system to cure itself and help in the process of healing. And these therapeutic medicines, our homeopathic medicines, are always used in therapeutic doses. That is to say, that is 1x, 2x, 3x, 200C and millisimal potencies. And in our homeopathic in our homeopathic practitioners, there is a fixed idea or there is a wrong assumptions that this higher potencies will not have a effect on the bodily system or the organ system. But it is unfortunate that higher the potency and the similarity of the symptoms is there, then possibility of cure is more, friends. Due to that reason, a well experienced physician, homeopathic physician, will use higher potencies, that is 1m, 10m, 50m and even millisimal potencies to cure the patients, simply because the medicine required is very minimal. The condition is it must be very similar to the picture of the drug, picture of the patient what we are presented with. Due to that reason, this minimal dose is a homeopathic concept of treating the patients. This minimal dose is nothing but the therapeutic. So therapeutic is the healing medicines. Due to that reason, this physiological, pathological and therapeutic doses I wanted to discuss and make you understand, friends. So if you like this video, please like, share and subscribe our channel. In future also I will be doing many enlightening videos. Please subscribe our channel. This is all today, friends. Thank you. Take care.